Dr. Geetha Lakshmipathy, Senior Consultant in Neurology, Apollo Hospitals. Stroke can strike at any time, and the effects of stroke can be devastating. It is very preventable and it's very treatable too. And one has to change the lifestyle in order to keep the blood pressure under control, sugar under control, and cholesterol under control. And people should stop smoking, drinking, and should have weight reduction, should walk daily, and have a healthy eating habit. And periodic checkup in a hospital is also very useful. Once a stroke occurs, you go to a nearest big hospital where there are facilities for treating acute stroke with thrombolysis. That's an injection which can be given for 4.5 hours after a stroke occurs. And even if the time window period is over, people can still have the clot removed by insertion of a tube, and the patient can have a very good recovery within a month's time. If the window period has fully passed, 12 to 24 hours are over, then also there is no problem. You can come to the hospital. You can have a treatment for the stroke. And also you should remember that many patients go back to their work after a stroke. What is required is continuous monitoring by the doctors, plus a team of rehabilitation people, like first the family support. There can be carers within the family, or they can employ professional patient carers and nursing staff round the clock, and also people like physiotherapists and speech therapists, and there are occupational therapists also who will lead the patient to lead a normal life. And some complications after stroke, for example, a patient can get fits after a stroke that requires separate treatment, or patient can have depression, anxiety, sleep disorders, and things like constipation can happen. So all these things have to be taken care of by the doctors. So once the patient is up and about, slowly he should start going to his work, maybe part-time initially, do light work, and then go on to the full-fledged job. So nobody need to be afraid of stroke. There is very good treatment available. You just have to rush to the hospital once the symptoms of stroke come to you. They are difficulty in speech, sagging of the angle of the mouth, weakness of one side, or vertigo, vomiting, or unsteadiness, and so on. If anybody has such symptoms, immediately they have to go to the hospital. Thank you.